This is a brief introduction to the Compensatory Reserve Index device, or CRI device. The CRI is a multi-institution study between Children's National Hospital, Phoenix Children's Hospital, and the Children's Hospital of Colorado. The goal of the study is to validate the CRI device as a clinical tool for early identification of hypovolemic shock in the pediatric population. One of the challenges in the care of injured patients is the early identification of intravascular volume loss before progression to hemorrhagic shock. Current volume resuscitation strategies in the setting of trauma are based on standard vital signs. Traditional vital signs can be unreliable due to many compensatory mechanisms which serve to maintain these vital signs. The body will lose up to 40% of total blood volume before having major vital sign changes. As a result, unrecognized volume loss during the compensatory phase of hemorrhage can quickly lead to poor tissue perfusion, progressive acidosis, and sudden unexpected hemodynamic decompensation. The Compensatory Reserve Index, or CRI algorithm, is designed to estimate an individual's proportion of total tolerable volume loss. CRI values range from 0 to 1 and reflect the proportion of physiologic reserve remaining for hemodynamic decompensation. The device has already been tested in multiple studies, resulting in FDA approval for use on adult patients. For this study, we'll be placing the CRI device on patients presenting as trauma activations in the code room. The device will remain on patients for 24 hours after arrival. The CRI machine connects to the patient using a pulse oximetry probe. The CRI pulse ox probes are labeled with neon tags to identify them as CRI research pulse oximetry probes. They are not interchangeable with the hospital pulse ox probes. The pulse ox probe can be readjusted or moved at any point, but must remain on the patient's upper extremities. Data does not need to be continuous, and it is okay to temporarily disconnect the device. The device is not MRI compatible and should be removed if this type of imaging is required. The CRI value has been covered up on the tablet so as not to influence clinical decisions. Do not remove the paper covering the CRI value. The heart rate, oxygen saturation, and pulse oximetry waveform will be visible to you. As the bedside nurse, your job is to make sure the CRI device is plugged in, the device is turned on, and there is a good waveform. Attached to each device is a bag containing additional pulse oximeter strips. Remember, the CRI probe is not interchangeable with the current pulse oximetry probe you'll be using with the patient. The tablet can be kept on the patient's bed or anywhere convenient for care. Always keep the device plugged in, as the battery life is only 2 to 3 hours. Monday through Friday, when it's time for the device to be removed, a trauma research team member will come to the bedside to remove the device. If the device needs to be removed on the weekend, the bedside nurse will be provided a time of removal. The CRI device can be placed in the shift coordinator's office, or if in the PICU, can be placed in the integration room. If you have any questions or concerns, please consult the information sheet attached to the device. The phone number listed can be reached 24/7 for assistance.